Hi and welcome. I am trying to learn medicine. Today, ankylosing spondylitis. After we've done that, we're gonna do body central training, medium plane training. I'm not sure about the name. And if you participate in the fitness part, then it's better at your own risk. And this is part 2 of ankylosing spondylitis, and we're talking about internal anatomy and the disease. Ankylosing spondylitis. And now we're trying to put together a presentation about it. This is part 2. A disease of the joints affecting mainly young men in their 20s and 30s. It usually affects the spine, causing joints to fuse as an unusual process of bone formations. Okay, by ankylosing spondylitis, the bones in the spine start to fuse together. Symptoms. Onset of symptoms is gradual over a period of months or years. Okay? Repeated attacks of backache in a healthy, fit person is another symptom. Okay, symptoms are attacks of backache in an otherwise usually healthy 20 to 30 years old person. Gradual onset of symptoms. Early morning back pain and stiffness. This can radiate down one or both legs. Back stiffness in the morning. Increasing stiffness over the whole spine, which may be revealed if the sufferer tries to bend down and touch his or her toes. Increasing stiffness, back pain in the morning and increasing stiffness. Tenderness over the hip joints. Chest expansion may be limited, and spinal joints are the main ones involved, but in some cases the shoulder, hips and knees may be affected. We try to mention that as well. The spine is usually affected, but also the shoulder, hips and knee can be affected. It would make sense if also the other joints, but... Duration. Slowly progressive over years. We're going to say gradual onset over months or years. Causes. No definite cause has been isolated, but the condition sometimes runs in families. Now, the book is from the 80s, so I think we're going to stay completely away from telling any causes, if the only one is that vague one. But if we say it might run in families. Complications. It might be that it runs in families. Complications. In the long term, regional ileitis, ulcerative colitis, and certain heart defects may develop. I don't know what ileitis is. Maybe we're going to say, okay, if we could say it, we could say regional ileitis, ulcerative colitis, and certain heart defects may develop. Now, we had a little talk about, I mentioned it someplace, but I was for quite some time wondering why it is called ulcerative colitis and not ulceractive colitis or whatever. Now, and I came across that in Italian, active is attive without the C. And that would make sense that the word is maybe of Latin or Italian or whatever, but that there is a language where the C is missing for the same word, active, attività. Iritis, inflammation of the eye, can occur in 25% of cases. Okay, we're having regional ileitis, ulcerative colitis, and now iritis. That is inflammation of the eye in the quarter. Certain heart defects can develop. Okay, long-term disease can cause the spine to become rigid, and this in turn leads to kyphosis, curvature of the spine, which with neck distortion can result in a crippling handicap. And the spine can get kyphosis, or the spine can start to curve and doesn't stabilize the body properly. And then it's possible search medical help, basically immediate to the doctor, and then the doctor takes the lower part in an X-ray, blood test to confirm the diagnosis, painkillers and anti-inflammatory. Yes, again, I forgot that. This is no medical advice, we're just reading about it. Painkillers and anti-inflammatory drugs will be prescribed to relieve the symptoms and slow down the progress of the disease. Okay, there are painkillers and anti-inflammatory drugs against it, which should also slow down the progress of the disease. And there's physiotherapy to strengthen the spinal muscles and mobilize the joints. If the pain persists despite the treatment with drugs and the condition is getting worse, then radiotherapy may be tried. In early cases, the results are excellent, with the disease process being apparently arrested. More advanced cases with fixed deformity can also benefit from radiotherapy. Radiotherapy has the risk of leukemia in 3 to 1,000. Prevention, where there is a family history of a disease, tests can assist in early diagnosis. Okay, if there is a story of ankylosing spondylitis in the family, then some tests could be made to find out if it is, so that the treatment can be started before it starts to develop severely. Outlook. For cases which are treated by anti-inflammatory drugs and radiotherapy in the early stages, the outlook is good. For cases in the more advanced stages, a combination of these measures can often restore the patient to a reasonable level of activity. Okay. Ankylosing spondylitis, that is with the vertebrae of the joints in the spine become stiff or fused together. During onset, repeated attacks of backache, also in the morning, can radiate on the leg, increasing stiffness, which can be seen if someone falls down. Tenderness over the hip joints, we tried to mention a bit. Tenderness over hip joints, chest expansion, and maybe also shoulder, hip, and knee. And complications are regional ilitis, ulcerative colitis, certain heart effects can develop, and iritis, inflammation of the eye, is a quote of the people. And then long term can the spine get rigid and build kyphosis, and it gets curved and it cannot hold the body stable. And if it is examined that it is actually ankylosing spondylitis, then painkillers can be given and also anti-inflammatory drugs. And these anti-inflammatory drugs can help to arrest the process, so stop the process would be okay. And radiotherapy exists also, which can also help to arrest the process and even turn it a bit back, that's possible. For cases in the more advanced stages, a combination of these measures can often restore the patient to a reasonable level of activity, and physiotherapy and family treatment. I want to start the camera and try to say that. Ankylosing spondylitis. By ankylosing spondylitis, the joints in the spine become fused. And the symptoms are that people who are otherwise completely healthy have backache, especially in the morning. And people 20, 30 years old which are healthy have backache in the morning, and also tenderness of the hip joints and problems to expand the chest properly. And it can also affect other joints, the shoulders, the hips, or the knees. And where comes it from is not said in this book, we have no idea, but it runs maybe a bit in family. And if someone has it running in the family, then there can be made tests early on that it is very early detected that the person maybe has also ankylosing spondylitis, so that the treatment can be started. Now the treatment is, if it is then examined that it is actually ankylosing spondylitis, that there are painkillers and also anti-inflammatory drugs. And these anti-inflammatory drugs, together with physiotherapy to mobilize and strengthen the spinal cord muscles and the joints, can help to arrest the progress, which is gradually getting the symptoms worse over months or years. And there's also radiotherapy, which can also help. And if it is early detected, the outlook is good. And even if it is a bit later detected, then together with the radiotherapy and the anti-inflammatory drugs, it can be helped. Now, complications can develop. If it is not treated, there can become iritis, that is inflammation of the eye in a quarter of the people, and also kyphosis, that is the spine getting curved and the person cannot be properly stable tall up. And also ulcerative colitis can also develop, and certain heart effects. Now that is according to Keith Hodkins' Family Medical Advisor book, page 75, but this is now medical advice. What was it? Liosis? Ilitis, regional ilitis, whatever it is. I'm going to stop the camera. And I could have spoken a bit more clearly, but I think it was okay. So that was the ankylosing spondylitis medicine part. If you were here for medicine, that was no medical advice. So that was no medical advice. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the central training or whatever, then it's with the diagonals. Now, what are we doing? We are standing with the legs a bit over the shoulder wide apart, and we're going down a bit into the knees, and now flex the upper legs and press also the legs together. Flex all the legs. And now straighten one leg. Keep the flexing and press the legs together. Straighten the leg and keep the flexing. Back into the middle. Bring the legs together, flex the legs, and straighten the upper leg. Press together into the middle, flex the legs, and in the middle. And now a bit wider apart with the legs. A bit down, flex again the legs and press them together. And now go to the side, straighten one leg, keep pressing together. Try to flex the leg muscles into the middle and over to the other side. Press the legs together and flex the muscles to the other side and back. Also for a little moment, stand good and stable and press with the legs to the outside. Okay, to the next exercise. One leg up and to a right angle. Flex foot even and hips taller with the back and press from the top against the knee. Little bend in the elbow. Now press on the inside. And now press with the leg up to the side, up to the side. And with the other leg the same. Leg up and press from the top against the knee. And now press on the inside. Press with the knee up and to the side. And another exercise. Leg up and press from the outside against the knee. And up slowly. And cross again. And on the other side, press from the outside against the knee, and up slowly. And back from there. And now, having 1 or 2 or 3 exercises on the ground. So we're going down on the ground, into the side plank, and up, that's the side plank. And we hold it a little. And now you can bring one leg up if you can. Hold it a little longer. And now, onto the hand if you like. And again into the middle. Bring one leg up, hand out, with the knee in and out. In and out. Let's do it one more time. And over to the So over to the other side, first on the elbow. Just side plank. And now if you like, okay, one leg up. And now full arm if you can. And one leg up if you can. And out and pull the knee in. One time. And down. And we're coming up. And we're doing a walker. Walk a bit over the place. And next one, heart breathing along. And again out. Again in. And out. One last time, breathe in. And out. Breathe in, close the legs. And breathe again out. That was the central body training, makes more sense. Central body training. Thank you very much, and until next time.